This morning on The Real Story, social media executives grilled for hours this past week on Capitol Hill, facing accusations they failed to protect children from predators, drugs, bullying, and harmful content online. Now, federal lawmakers, including Connecticut's own, pushing for legislation they say will hold these companies accountable. But first, a new report from the comptroller's office about the state of healthcare in Connecticut and what needs to change. We're breaking down the issues and proposed solutions with two advocates in the industry, part of Connecticut's healthcare cabinet. All that and more ahead on The Real Story. Good morning, and thanks for joining us on The Real Story. I'm Emma Wulfhorst. Joining me now, Dr. Paul Dworkin, Executive Vice President for Community Child Health at Connecticut Children, and Maria Coutant-Skinner, CEO of the McCall Behavioral Health Network. Paul, Maria, thank you both so much for joining us here.
Pleasure.
Thank you, Emma.
So I mentioned Comptroller Scanlon's new report. Before we get to that, he created this healthcare cabinet last year made of policymakers, stakeholders, practitioners, advocates, with the goal of discussing healthcare challenges that are facing people across Connecticut. So tell me first, which subcommittee each of you are on, and really how you came to be a part of this. Maria, we'll start with you.
Sure. I had the honor of co-chairing the Mental Health Subcommittee along with Dr. Javid Sukhera from Hartford Healthcare.
And tell me about how you got to be a part of this healthcare cabinet.
Yeah, so the comptroller held a number of roundtables around the state and looked at the issues facing healthcare and what kind of rose to the top as some of the critical needs, and what are the stakeholders in each of those respective areas that would be willing to take part in brainstorming big vision solutions for those issues. So we had a tremendous subcommittee that was comprised of, people who were from every sector of the mental health care delivery system, folks who have, MDs, also policy, Connecticut Health Foundation, the universities. So this was a really tremendous, diverse, thought-provoking and dedicated group of professionals.
And Paul, you're a co-chair of a subcommittee as well, correct?
Yes, I am. I'm the co-chair of the Children's Subcommittee with Alice Forrester from Clifford Beers. And my story is really very similar to Maria's. Back in September, the comptroller held a children's healthcare summit at Sacred Heart, and Connecticut Children sent 4 of us to participate in that summit. And I somewhat surprisingly found very quickly that I was heavily engaged in the conversation. It was so consistent and synergistic with so many issues that we have been addressing over the years. And as a result of that convening, I subsequently was invited to serve as co-chair, and we also had a really dynamic, engaged group of about a dozen individuals who met and ultimately came to consensus on recommendations.
And Maria, you mentioned it a little bit, but we'll start with Paul. What have you been doing in the last year as a part of not just your specific subcommittee, but as of this healthcare cabinet as a whole?
Yeah, well, our engagement has really been, my engagement has really been since the early fall.
Okay.
Children's health got off to a little bit of a later start, I think, than a number of the other subcommittees, but we've more than made up for lost time. So since the original summit convening and then the formation of the subcommittee, we held 4 subcommittee meetings with, again, virtually all members of the subcommittee actively participating. We had a number of smaller group discussions over that period of time, shared a lot of resources and materials, and ultimately by the end of December came up with our recommendations that we submitted to the comptroller.
And similar timeline for you as well, Maria?
Similar timeline, and I would say, you start with something as massive as solving all of the issues facing healthcare.
Right.
And then you bring it down to the committee level to say, okay, let's look at the healthcare, behavioral healthcare component part of that issue. And it actually, as we talked about, there was a lot of intersectionality, a lot of through lines, and all of the synergies that Paul talked about. That becomes overwhelming. So when you talk about the need and you talk about the issues that are facing, I think all of our nation, and you try to say, okay, well, if we could bring our big picture, solution-focused thinking to this, where do we start with that? Right. We have to start with assessing where the current needs and gaps are. Right. Where are we failing? Right. And then from that, what are the potential solutions? And then what's feasible? Right. So coming up with a short-term immediate goal and then a longer-term goal was where our committee landed.
And that was the point of this report that was just released, the 2024 Comptroller's Healthcare Cabinet Report. Tell me a little bit, we'll start with Maria, about what some of those specific findings were for your subcommittee. What were some of the issues that came to light, and what were some of those, as you said, shorter and longer term goals that were discussed?
So I think there were three through lines that came about in my subcommittee, but then we certainly, at the summit that the comptroller convened, we heard, again, these through lines were everywhere. Right. So we looked at finances, we looked at access, and we looked at workforce. Okay. And these were the things that every time we were meeting and having these conversations, I don't think that's independent to even this work. This is what comes up, in many of the meetings that we're talking about when we're looking at solutions. And so I think one of the things we talk about is that we sort of have this presumption that the healthcare workforce is a group of well people that is taking care of a group of sick people. Okay. When in fact we're all human beings and we're all having all of the complexities that are involved in having a human experience. And we've had these disruptors to our culture and our society where each time we say, there's lessons to be learned here. So if we look at the opioid epidemic, if we look at the COVID pandemic, if we look at George Floyd, if we look at the current mental health crisis, these are things that, if we're paying attention, there's really valuable lessons to be learned. And one, if I was going to boil it down, is to say, if we decide to care enough, we can make significant changes. So I think one of the things I was really struck by was at that summit, we were in a room full of people convened by the comptroller that cared deeply about healthcare in Connecticut.
And Paul, for you?
I was also so impressed and actually relieved to hear the similarities in both issues and recommendations across all the subcommittees. There was remarkable synergy, and again, that was very, very validating. The other thing I would say, and I totally agree with Maria, this was a daunting task to undertake in the course of a couple of months, but Comptroller Scanlon set this up in a way that was both clear and reassuring. First of all, he spoke about this work as an experiment in civic engagement and political will or political leadership. By virtue of the hundreds of people who participated on the 8 subcommittees, clearly there was civic engagement. Right. And now that we've generated recommendations to have the political will and political leadership take on promoting these recommendations and moving them forward should be extraordinarily helpful. Secondly, he told us to think big and not be limited by realities of constraints. That also was very encouraging for us to recognize that we didn't have to worry about setting limits, even realistic limits around what we were proposing. And the third thing that he encouraged us to do is not think about this as a set of recommendations that will sit on the shelf somewhere, but rather think about this as a living, breathing entity that will continue to evolve in response to critical contemporary issues and opportunities.
And the 2024 legislative session is gaveling in just a few days. As you said, I thought it was really interesting. You talked about this as kind of a living, breathing entity. This report is going to change as the world changes. But when it comes to healthcare, mental health and children's healthcare, as you said, a lot of the same issues. What do you want to hear from lawmakers now that they're about to get into session? What were some of those specific policy initiatives you're looking for? And what do you hope either lawmakers know or what do you want to hear from them in terms of a response, Paul?
Yeah, well, let me again just briefly comment both overall on the issues that all of the subcommittees identified and what hopeful responses will be, and then offer just a couple of specifics from our work on the Children's Subcommittee. So in general, the themes clearly were lack of access, need to enhance access, and similarly address the cost of health care. Relatedly, the gap between payment for services, and we could use Medicaid, but it's not the sole example across payers, but the gap or the discrepancy between reimbursement and the cost of delivering care. That's clearly a problem. And then the pervasive inequities that exist, particularly among underserved populations that need to be addressed, so that many of the recommendations are designed to specifically address those and other equally compelling issues. From the standpoint of the Children's Committee, we limited ourselves because part of the instruction was to be focused and not provide a very, very long laundry list that would be impossible to respond to. So we limited ourselves to 2 to 3 really key areas. One is to really think about strengthening access for children by taking full advantage of those programs and services that are already in place and ensuring full enrollment, ensuring optimal use of dollars that are available at the state level, and really make sure that we're closing the gap between needs and resources. Secondly, we in the children's arena believe that children are an ideal place to start from the standpoint of healthcare reform. We know what the interventions are that make a difference over the long term. Children's health care is not as expensive, but we also know that children's health care, when practiced most effectively, has an incredible return on investment, both in terms of short and long-term savings. So we were bold enough to recommend that the comptroller consider within the state employee plan, which he oversees, a pilot study that would enable us to look at a new quote-unquote value-based care model for children's health care, with the idea that if it's successful, it could inform similar plans both across the lifespan and across other payers, public and private.
And Maria, quickly here, what were you seeing specifically for mental health? And Paul brought up inequities, and access is always a big part of that conversation. Is there anything you want lawmakers to know or any recommendations your subcommittee had about how to bridge those inequities? Because I'm sure you're seeing them in mental health as well.
Absolutely, and everything that Paul talked about, I would want to underscore and put an exclamation after regarding some of the disparities, and that's in spite of, I think we have lawmakers that really earnestly want to do the right thing by their constituents. And so sometimes it's just a matter of let's make sure they're aware and point out where these discrepancies exist, and that still the quality of your health care, unfortunately, and access to quality health care still can be dictated by the insurance card in your wallet. So some of the specific recommendations that we had was to also look at that the payer and the disparity between the cost of delivery versus reimbursement rates. And we also looked, and I shared a story, I'll try to just summarize it quickly. It's the story of a therapist who worked at McCall for a number of years, highly trained, highly skilled, beautiful human being. And all through the pandemic and through really critical times, this is a person who showed up trained other clinicians. And I remember that she lost a client to an overdose.
Oh, wow.
And I went to her in that moment, that evening, and I held her while she wept. And I will never forget the feeling of holding her and knowing that her heart was breaking. And that this, unfortunately, is an all too common story for the mental health workforce, and that we have to take good care of them. And I think we've accepted as normal the pace at which healthcare providers have to deliver services, the overwhelming patient loads that they have,
Right.
And that we keep basing all kinds of decisions on productivity rates and workloads that are completely unreasonable. So one of the recommendations we had was actually to have insurance for the mental health workforce to be able to get their own mental health care.
Right.
The other one was also for a pilot to look at a multidisciplinary rollout of access to mental health care that is high level, immediate access, and look at the outcomes of that so that we can roll that out on a broad scale.
Well, Maria, Paul, I wish we had more time here. So much in this report, but thank you both so much for being here. Healthcare, always a big topic, and especially this legislative session. You know, I'm sure we'll be speaking again, and we'll see how this all gets sort of tackled this legislative session, but appreciate you both being here.
Thank you.
And there's still more to come here on The Real Story. Lawmakers on Capitol Hill want answers from social media giants grilling tech CEOs for hours this past week.
Mr. Zuckerberg, do you believe that you have a constitutional right to lie to Congress?
Your platforms really suck at policing themselves.
Coming up, we'll have more on why legislators are accusing these companies of failing to protect children and how social media executives are responding. Stay with us.